Hi, this is Jessica Damasa, and I'm here at HIC 2017, and we are in the OneView booth, and I'm with Oran. Oran, please introduce yourself for everybody watching.
Thanks, Jess. So my name is Oran Rigby. I'm the Executive Medical Director for OneView Healthcare. We're a global company that really focuses on healthcare and the patient experience. We're based out of Chicago, Dublin, and indeed Australia. We're an ASX-listed company, but a curious hybrid of an Irish-based company listed on the Australian Stock Exchange. So a bit like myself, I'm an Irishman originally, and a surgeon, medical practitioner, and I'm living in Australia for 20 years as well, so it's kind of a nice mix.
Fantastic. So tell me a little bit about what OneView does. How do you improve the patient experience?
Sure. I think what we've found over the last few years is that increasingly the importance of the patient experience and customizing the patient experience to that of not just that sterile, impersonal encounter, but actually being able to engage the patient in their own decision making in the hospital, and such that it's a much more welcoming, customized experience. And the way to do that and engage people is through empowering them. And how do you empower people? Give them the tech to do it. Okay. And I think that's what OneView does. Yeah.
Talk to me about that. So give me a specific example here. What kind of tech are we giving people? An app, a game, what?
Yeah, so we've got a number of solutions, one of which is an app. So the Connect app is something that's gone live in the Westmead Children's Hospital. So one of the largest hospitals, children's hospitals in Australia. And what Connect does is, well, this is what it says on the tin, connects the patient with the caregiver, with the surrogates, with their carers, with their scheduling. It can actually allow you to communicate with the nurses, with your clinicians. If there's, say, just a quick query about should I take this tablet maybe at 8 o'clock rather than 9 o'clock, or is it the blue one or the pink one type thing. Those kind of messaging is one component. Scheduling, to be able to change the scheduling of your appointments is a key thing. And there's also the telemedical option as well. If you really actually have an urgent request, that might save you the trip. 300-400 kilometers. Some of these patients are coming and traveling all the time. So they're the conveniences of the external solution. We also offer an inpatient solution, which ranges from a whole host of entertainment options to clinical options that include nurse rounding, so nurses can see at a glance what the priority of the patient is. So it might be something as simple as, do they need a glass of water, or indeed are they having a heart attack? What's happening here? So how do I prioritize my care? Okay. And that's part of the efficiencies of that, is also getting the room ready, getting turnover. So having the availability. One of the big things we've noticed talking with both executives of hospitals, but also the clinicians themselves, is that patients are languishing in bed for much longer than they need to be. They're ready. They want to get out of hospital. They want to get home. So how do we expedite that process, and how do we have the visibility that someone is clinically ready to go home, have the doctors around and have the discharge that, and we can do that from a distance using telemedicine as well. And then I suppose at a centralized process, you can see which beds are ready to go. So almost like a hotel experience that you can actually expedite that, and really it's all about getting that turnover and shortening those bed delays and maximize the efficiency.
Fantastic. We're all about that here at HIC. Yep. So tell us a little bit about your experience here in the booth here at HIC 2018. How's your traffic been? What's been going on?
No, sure. Look, it's been a really exciting conference, actually. What we've found, I think in summary, it's quality, not quantity. So the people we've been talking with and who've been exhibiting, and indeed the conferences that we've attended, and Bernard Salt particularly comes to mind, his talk on demographics and where the aging of the great tsunami of how the impact on healthcare. The delegates, the people we've met, these are all pretty senior people, they're the decision makers. But what's more, they're knowledgeable in the tech space, so you're not actually spending a lot of time trying to communicate with them your value add. They get it straight off. It's just it's implicit, and they actually these are the people who we want to meet. Perfect. to I suppose to convey what we're trying to achieve, what we cannot achieve, the solutions we have. But I think that's one aspect. It's also the educational. Certainly, as a medical practitioner myself, and someone who's always quite passionate about the fusion of technology with healthcare, we've really learned some interesting kind of insights into some of the problems out there, and it kind of, I suppose, gives you a bit of certainly some inspiration for some solutions and how we can address those as well.
Fantastic. Well, we look forward to seeing you at HIC 2018 with some of these new solutions, hopefully debuting here at the OneView booth. Thank you so much for joining me and for explaining what's going on. Oran, it's been a pleasure. Thanks so much. Thanks. This is Jessica Damasa at HIC 2017.